Hello and welcome to the first Happy Feet program of fall 2025. We have our wonderful speaker here tonight about movement. It's Dr. Erica Schleicher, and she is a postdoctoral scholar in the National Cancer Institute funded Translational Research Training Center and Cancer Prevention and Control Program at the University of Pittsburgh. Before pursuing a PhD in health behavior at the University of Alabama at Birmingham, Dr. Schleicher worked as an exercise physiologist at the Penn State Cancer Institute under the direction of Dr. Catherine Schmitz. She has worked on studies involving resistance training and protein supplementation in cancer patients and survivors, development and implementation of exercise interventions during treatment, and improving survivorship care. Her research focuses on the role of physical activity in cancer care, specifically tailoring exercise interventions to improve side effect management and quality of life for people living with and beyond cancer. Dr. Schleicher aims to continue advancing research that helps cancer patients adopt a healthier lifestyles and to push for exercise to be a standard of care for a cancer diagnosis. Before I forgot to mention, could everybody just mute themselves while Dr. Schleicher speaks? And over to you, Erica.
Awesome. Well, thank you so much for having me here to speak to everyone today. And I'm really excited to talk to you guys about movement, motivation, and keeping that momentum as you're going through cancer treatment and on into survivorship. So that was a wonderful introduction. Oh no, let me see if I can. It's not. Okay, there we go. So thank you for the introduction. So as she mentioned, I am a what we call a postdoc for short at the University of Pittsburgh and also UPMC at the Hillman Cancer Center. And I work.
Oh no, you're frozen, Dr. Erica.
All right, so thank you guys so much. So that being said, I did a lot of my schooling down south. And so I most recently got my PhD down at the University of Alabama at Birmingham, commonly known as UAB, in health behavior. So as an exercise physiologist, I learned that exercise was really good for cancer patients. And so I went on to go get my PhD to learn how to get people to exercise. And so let me just hide one thing because I can't see my. Okay, there we go. So, talking about the cancer continuum, I'm going to talk about exercise right at the point of diagnosis. Maybe there are some people who may be starting treatment or starting a different treatment. So, that would be good to talk about exercise then, exercise during treatment, and then after treatment. So, a lot of times this is called post-treatment survivorship. And so, exercise into survivorship, and then exercise with a cancer recurrence or living with chronic cancer, so having metastatic cancer. And so common cancer treatments are surgery, radiation, chemotherapy, hormone therapy, and I'm sure, as you guys know, there comes with a lot of side effects. And those can be decreased muscle mass, decreased physical function, fatigue, insomnia, neuropathy, depression, and anxiety. And all of these things can decrease your quality of life. And so there are also short-term side effects and long-term side effects. So I'm sure you guys have experienced some of the short-term side effects with treatment as you guys are going through it. But then there can also be long-term side effects as well. So some of those short-term side effects can linger even after treatment is finished. And then some new ones can pop up maybe. And so it's really great to use exercise to kind of prevent some of the long-term side effects from happening. And so, like I just mentioned, exercise can do a number of great things. And so we typically try to aim for 150 to 300 minutes of moderate to vigorous aerobic physical activity or exercise and twice weekly resistance training. And so that sounds like a lot, but if you break it down, it comes out to be about 30 minutes, 5 days a week. So going for a walk for 30 minutes, 5 days a week, and maybe doing some strength training in between then. And so if you do follow these recommendations, you'll see an increase in quality of life. There can be an increase in muscle mass, improvement in physical function, improvement in fatigue, insomnia. You can actually help prevent further progression of neuropathy. You can improve your depression and improve any anxiety. And so, just to go over some terminology, there's aerobic exercise, which is also known as like cardio exercise. And this is physical activity that uses large muscle groups in a rhythmic or repetitive way. So, walking, running, anything that gets your heart rate up, and increases your oxygen consumption. And so, like I just said, walking, you can be on a treadmill. Some people love running. As an exercise physiologist, it's not my favorite exercise, I'll be honest. And so if you're not a runner, that's okay. There's a lot of other aerobic exercise that you can do. You can go biking, swimming, there's a lot of things. And then there's resistance exercise. And so with resistance exercise, that's strength training. So using resistance to build muscle and build strength. And so that can be through a number of different things, through weight training, just using your body weight exercises, resistance bands, as I heard you guys are going to be using, and even like Pilates yoga, that can be considered resistance training. And so when I say exercise intensity, I mentioned moderate to vigorous exercise intensity. And I have these numbers here. If you want to get into the nitty-gritty of it, you can. And so it's looking at your heart rate. So if you take your age and subtract 220 from your age, that is your maximum heart rate. And so you want to be within a range of your maximum heart rate. 50 to 70% is moderate, vigorous is 70 to 85%. Now, there are a lot more easier ways to figure that out as you're exercising. And one of those things is called the talk test. So for moderate intensity exercise, if you can talk but not sing while you're walking or doing some of your aerobic exercise, then that's around moderate intensity. If you're doing vigorous intensity, you won't be able to say much more than a few words without pausing and needing to take some breaths. So that's when you know you're working really hard and right at the most vigorous. And so, talking about exercise and cancer prevention, I know there are some caregivers in here, and even people after treatment, you can still be preventative for other cancers with exercise. And so, they found that physical activity can help prevent at least 7 different types of cancer, from bladder, breast, colon, endometrial, esophageal, kidney, and stomach. And so, higher levels of physical activity are linked to lower risks. And decreasing the amount of time sitting also helps with colorectal, endometrial, and lung cancers. And so talking about exercise right at the point of diagnosis or before you begin a new treatment. So there's something called prehabilitation. And so that is starting to get exercising and moving in anticipation of starting a new treatment. So this can happen right at cancer diagnosis or if you just start a new regimen. And so really this is a graph that we like to use. It's all encompassing, not just exercise, but ideally thinking about exercise, it's getting moving right before your treatment. And so there are a lot of immediate and long-term effects from having some exercise before you start. And so talking about that, any amount of time leading up to the new treatment is enough time to start exercising. If you're starting a new treatment next week, then you can definitely see improvements by starting exercise, just within a week. And it also helps to just get into the habit of being active. So even after you have your treatment or have surgery, you can still get into that habit. And so thinking about prehab, resistance training should be a focus. We really want to focus on building up your strength and endurance for that time. And also stretching and increasing your flexibility is really important, typically before surgery. So I know a lot of women deal with breast cancer and may have had breast cancer surgery or may be scheduled for surgery leading up to it. And so it's really great to improve that flexibility, especially in the upper body or around the area that you might be having that surgery to improve later on afterwards. And so now talking about exercising during treatment. So this is a little infograph and it's very popular and I plan on sending some resources to you guys. So hopefully we can send that out through email. And so this infograph, it's a little small, but basically it talks about different cancer-related outcomes or really side effects and the different types of exercise dosaging that you need to see quality of life improvements. And so if you're dealing with cancer-related fatigue, then getting 3 times a week of 30 minutes moderate intensity is a great amount for what you need to deal with fatigue. And then also there's strength training along with that. And so there's different things here, just general quality of life, improving physical function, anxiety, depression, lymphedema, if you are dealing with that as a breast cancer patient or survivor. And then also dealing with bone health and sleep. Those are things that can also be improved with exercise. And so I want to touch on fatigue because cancer-related fatigue is the symptom that I heard about most when I was working with patients in clinic as an exercise physiologist. It is a constant for some people and it can really get in the way of life. And so we want to be able to find ways to kind of avoid fatigue or try and help diminish some of that. And so, one of the things that can help with fatigue is walking. So, one thing that I love pointing out to people is that there's no pharmaceutical treatment for fatigue, but actually, walking is the one thing that has been found to clinically help. And so, if you can get out walking, that's the best thing you can do when you're feeling tired. I know it can feel counterintuitive, but if you stick with it, typically people see benefit right away, but really long-lasting benefits can happen if you get into the habit of doing it for at least 12 weeks. And so talking about exercising during chemotherapy, there was actually a research paper that was done by Dr. Melanie Potiempai, and she is part of the Happy Feet group, and I'm sure you'll be hearing about from her or from some of the people in her lab. And so she really wanted to look at is exercise really helping during chemotherapy? Because chemotherapy can be a really tough time. And so there's a lot of kind of research terms in here, but I'm going to generalize it. And so we know that sometimes when you're on chemotherapy, there are a lot of side effects, and those side effects can affect whether you are receiving chemotherapy. Sometimes your blood counts can be low, or you're having side effects that mean you might need to reduce your dosaging. And so, in order to have the best treatment efficacy and have the best overall outcomes, you really want to get as much of that chemo dosage as possible. And so, we wanted to see if exercise can help improve what we call RDI or receiving the chemo and reduce chemo-related side effects. And so, in addition to all of that, there's also improvements in patient-reported outcomes, and it has potential to really improve your uptake of chemotherapy. And so ultimately, what we found in this research was that exercise is good as a supportive care therapy, and it does help with the uptake of chemotherapy and improves treatment outcomes. And so the biggest factor with that was exercise adherence. So exercising on a consistent basis had the best improvement. And so when talking about exercising consistently, you have to think about the behavior, and it's not always easy meeting those recommendations. Life gets in the way and side effects get in the way, and that's understandable. And so we need to figure out ways on how to improve physical activity and working around, different barriers. And that's where some health behavior theory comes in. And so we look at personal factors, environmental factors, and behavioral factors that can all help improve being more physically active. And so just thinking about some things, what motivates you to exercise? So there are a lot of different motivators to exercise, whether it's improving your health, improving your treatment outcomes if you're currently going through treatment. It can help with a lot of the side effects. can help with anxiety or depression that can come along with a diagnosis, and that can really motivate somebody. I know that my mom is aging and she's really motivated to stay active and be able to play with her grandchildren and really keep that physical function going. And so that can be a huge motivator. I really like spending time out in nature, and so that can be a motivator. So you have to find little things to motivate you to exercise. But then on the flip side, there are also things that can prevent you from exercising. So there can be a number of barriers. So many things can get in the way, whether it's your schedule, your family, and side effects going through treatment. There's a number of barriers that can happen and can really get in the way of exercising. And so learning how to overcome that and finding ways to motivate is really important. And so, talking about motivation, there are three things that are really key things for motivating when it comes to exercise. And the first thing is self-efficacy, which is your confidence to start exercising. So, your ability to actually take that action and start exercising and being more active and overcoming those barriers. You know, if you feel confident that you can overcome anything that might stand in your way, you're more likely to do it and do it more consistently. Social support. So, being a part of this program is a huge motivator. Having people around you holding you accountable, something to look forward to, seeing your friends, it can really help motivate you to be more active. And then, like I just mentioned, barriers. There's a ton of different that can get in the way. You may know that you need to exercise and that exercise is important, but actually doing it can be difficult, and that's okay. And so there can be a lack of space, scheduling conflicts, social influences, and your side effects that may happen, and also fear of injury. You know, as you're going through treatment, there can be a lot of different unknowns, and it can be scary starting a new habit, especially like exercise. And so, talking about some behavior change techniques, there's a lot of research behind it, but I don't want to go into the nitty-gritty. But overall, what they found is the interventions that were most successful in changing someone's behavior was having supervised training and also goal setting, setting easy tasks, and then having that exercise instruction, someone showing you how to start. And so we're going to talk about a number of these. So there's supervised exercise, goal setting, self-monitoring, action plans, social support, and practice. And so supervised exercise, this is something that you guys are actually already achieving by being in this group. Going and attending the Thursday exercise sessions are a great way to get some supervised exercise. Instruction on how to exercise can be really helpful. So you may learn now, and later on, you may not be doing this program, but you know how to exercise and you can continue that behavior later. There are exercise oncology professionals like myself and like many at UPMC. There are others all around the country and at different health networks in Pennsylvania as well, who can really help you with figuring out how to exercise with a cancer diagnosis. And then there are a lot of online videos and classes as well that can help. And so goal setting, this is such a big key point to really getting that behavior change going. And so starting low and slow, you want to make small, achievable goals and make them realistic. And after a while, reassess. So set some goals. And after a few weeks or a few months, kind of reassess. Have you been hitting those goals? Should you set goals a little bit higher and kind of progress yourself? Or maybe some of your goals didn't work out. And so kind of reflecting on what happened and reassessing and figuring out how you can overcome any barriers that got in your way. Self-monitoring is also a great motivator. So there's a lot of different watches, fitness trackers. I know a lot of people love having the Apple Watch to be a self-monitor. Those are great ways to keep track of just how much you're moving. Exercise logs are another great way to progress yourself and to just keep track of how much you're doing. And really, you can then look back and be proud of yourself because, you know, getting any movement in is really a good thing. You can set movement reminders. So you can set a timer, an alarm. You could set it on your watch if you have like a fitness tracker. to every so often remind yourself to just get up and get moving. Because as we get going throughout our day with work and treatment and everything else going on, sometimes we can forget. And then just setting a habit tracker. I do bullet journaling, and so I like doing a little habit tracker, and getting to color in that box really, for some reason, is a great motivator. And so setting an action plan. When you make a schedule, when you know when and where you're going and what type of exercise you're doing, when you have a plan, it's a lot easier to stick to it. And then you can also have a plan for when you come across barriers. So, what to do if you run into a barrier, or if you run out of time that day, how will you work in exercise some other way? It's really great to just have a plan because it makes it easier to stick to. And then also practice. Practice makes perfect, but it isn't always perfect, and that's okay. Sometimes even for myself, I might be exercising and still think like, oh, I'm tired afterwards, or think I didn't go as far as I maybe wanted to, or maybe I didn't hit a goal that I had set. That's okay. And I don't want that to discourage you. It takes practice. Being active is truly a behavior change, and it takes time to really get into the habit. And social support. So you're going to have a lot of social support in this group. And if you're a caregiver, you are the social support for so many people that it's really important to understand that role. And as patients and survivors, you can be social support for others as well. And so really finding that community can be great. And so getting a workout buddy, joining a walking group or workout class or a program like this is so perfect for finding that social support and having that accountability. And so these are everything that I just talked about. And so one thing that I use in my personal life a lot when I am not motivated is the 10-minute rule. And so you've made a plan. I told myself I was going to exercise today, but I just have no motivation. Or maybe you are dealing with some side effects and you just really kind of want to put off not going and doing that workout, and that's okay. And so I like to do the 10-minute rule. So taking 10 to 15 minutes, even if you really have decided I'm not going to go work out today, just get ready. Put on your shoes, put on some exercise clothes, maybe roll out the mat if you're doing it at home, and just get ready. And after about 15 minutes, if you still are feeling really unmotivated or just still really not feeling it, then that's okay. And maybe it is time to rest. But a lot of times after 15 minutes, you already have that momentum going, and you're more likely than not going to just go ahead and exercise since you're already ready to do it. And I always tell myself, I'm not feeling it after I do these 10 minutes. I'm still probably not going to be feeling it. And most of the time, I end up still exercising or just doing a little bit of something. Maybe you don't do the entire workout, maybe you only do half, and that's okay as long as you did something. So try the 10-minute rule if you're feeling a little unmotivated. And then it's also important to recognize when it's time to rest. As you are going through treatment and, recovering from any side effects you may be having, then it is important to rest. And when to know when to rest is really good. So a lot of times after 15 minutes, if you're still really feeling bad or still really just not in the mood for it, or some side effects may have come up, then it's okay to rest. And, give yourself the time to rest and allow yourself that it is okay and you can be active another day of the week. And so, yeah, when is it time to rest and when is it time to push through? There are times where it may be necessary to push through. A lot of times if you're just feeling fatigue, that's one of those times that I would encourage you guys to push through. Fatigue is one of those things that can actually improve with physical activity. It's very counterintuitive, but it works. And so, but if you're feeling some other side effects, maybe you're feeling nauseous or you're having some pain from surgery or anything like that, it is important to check in and decide whether you should be resting or you should be pushing through. And so talking about exercising after treatment. So Exercising after a diagnosis with breast, colorectal cancer, or prostate cancer may actually decrease the chance of reoccurrence and it can improve survival. And so, exercise can be used for long-term side effect management in your post-treatment survivorship. So, just finishing up treatment. And so, again, this chart that I showed earlier, it is still relevant for after treatment as well. All the same exercise recommendations are the same after treatment. And I will also make sure to send that in an email so you guys have it to look at. And then talking about recurrence or living with chronic metastatic cancer. So exercise for people with metastases can be a little bit more delicate, just depending on where the metastases are. So if there are any metastases in the bones, depending on where it is, can be important to know when you're exercising. But even if you do have metastases, you can still be exercising safely. If you have metastatic cancer, I really do encourage you to check in with an exercise professional about exercising maybe beforehand, before starting, if you're not a regular exerciser already. And actually, being in this program, I know the exercise professionals that you'll be working with, and they are very well trained with working with metastatic individuals. So if you have extra questions for them, or they might have some caveats for you as you're going through the training sessions, that's important to listen to them. And so you can follow the standard exercise recommendations that I just showed you. And there just might be a bigger focus on making sure you're having the right posture, the right control with your movements, and making sure that you're just moving safely when you have metastases in certain areas. And so this is a lot of just kind of what I just summarized in words. But it is still safe and encouraged to exercise even if you have metastatic cancer, and it can really make a huge improvement to your quality of life. And so there are some exercise oncology resources. So the UPMC Hillman Cancer Center, their website has a lot of online resources that you can do or you can look at. And you can find this through their website. Even if you just Googled moving through cancer, it will pop up. And so there are different resources based off of where you are within Pennsylvania. So there are certain gyms that have exercise oncology programs that we recommend you going to work with those professionals. And they are listed based off of where you live. And then, and as you can see here, like this is an example of one of them. And so YMCA has a lot of good programs, and not every YMCA has it, but the Live Strong program within YMCA is a great one for cancer patients and survivors. And also, there's actually Dr. Potiempai in this picture here working with a patient. We used to work at Penn State University, and so some old resources from what we did years ago are still there. And so there's the Oncology, Nutrition, and Exercise group, and they have a lot of great online videos. And so there are actually exercise workout videos that you can do along, and you actually might see me in some of them. And so doing those exercises, if you don't feel like going to a gym or you just prefer exercising at home or doing it online, these are also great resources. And I will include all of these to be emailed to you guys as well. And so the takeaway message today is just to try to be active and motivate to be more active. And any little bit of exercise helps. If you can do 5 squats in the morning and 5 squats before bed, that is great. And that is really going to make an improvement. And so if you can try and get 150 to 300 minutes of moderate to vigorous exercise and work in some strength training, which it sounds like you guys already are with this program, then you're going to really be set. And so do you have any questions for me now?